Welcome back. We conclude our series tonight on mental health care inside Minnesota's jails in this final report and took a look at which solutions are working and what still stands in the way of lasting statewide change. Across Minnesota, counties and advocacy groups are experimenting with new approaches to support incarcerated people with severe mental illness. These initiatives aim to keep people out of jail when possible, provide humane treatment when incarceration is necessary, and ensure continuity of care after release.
We're bringing in all these other folks, whether it's a teen challenge type of support, whether it is the NAMI mental health support, or faith-based support. We have a team of detention deputies who are trained in working with developmental disabilities. We've got people coming in constantly, and they're always available for all the detainees at various times.
Olmsted County also works with social workers and case managers to connect residents to resources as they leave jail, though staffing and space are limited.
Mental health needs are far greater than they were back in the 1980s. As a young deputy, I'd go to maybe 2-3 mental health kind of suicidal related calls in a year. Now our deputies are seeing maybe 2 or 3 in a day.
In 2025, the Minnesota Office of Ombuds for Corrections highlighted key solutions to this growing challenge, expanding community mental health services to prevent criminalization, creating a coordinated system linking courts, jails, and treatment facilities, providing therapeutic services and consistent access to medications and counseling in jails, as well as improving transparency through a statewide dashboard that tracks wait lists and placements.
I was blessed to be at a facility that's what that operated in. But going to other institutions like that I had been at, those things are not addressed.
At the Capitol, lawmakers discussed proposals to respond to those gaps, including adding 50 beds at the Anoka Metro Regional Treatment Center, strengthening the priority admissions review panel, and requiring jails to continue medications people were prescribed before incarceration. Many of those proposals face funding challenges and have not yet moved forward. Advocates say continuity of care is one area where progress is already underway.
We worked a few years ago, advocated for DHS, and they did a pilot program to actually help pay for some of the medications, because some of those can be real expensive, and actually also to give technical assistance to jails in how to administer.
NAMI Minnesota also advocates for forensic navigators, which are trained staff who guide individuals through the criminal justice system, connect them to mental health services, and help prevent unnecessary jail stays.
As a way to avoid that revolving door. So that they don't get just put back out on the street with no resources.
State and local agencies are also exploring ways to create secure therapeutic options for residents waiting for state-operated mental health treatment. Unused space in local correctional facilities could be adapted to provide care in a more supportive environment than traditional jails. Then there's intensive residential treatment services.
But we wanted specifically to look at funding for locked IRTS facilities as a place for treatment, but a much better place than a jail, but still has a locked element, which can help judges and prosecutors feel more comfortable.
Some counties are already making progress. Dakota County recently opened a $14.4 million integrative health unit designed with trauma-informed features to support residents with mental health and substance use challenges.
What do you feel like would be the first step right now, or just something you would like to see changed policy-wise?
Do they need to have things put in play? Yes. But how do you get the masses to change the culture to get that done?
Now, ideas exist and the blueprints are taking shape, but what's still uncertain is whether those plans can move fast enough and far enough to meet people where they are.